Start with the pledge.
Start with the pledge. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I welcome everyone here. Before we start everything, I think it's appropriate because we don't know some people here. New people, new faces. We're going to go around the room and introduce yourself. And we'll go from there. I'm the chairman of this committee. I'm Paul House, legislator, District 8. And I also sit on the EDP committee.
Roy Rehill, from District 5, Constantia. I'm co-chairing or vice-chairing with Paul here, and I'm also chair of the Transportation Advisory Committee.
Lee Walker Jr., county legislator, minority whip. Nice to meet you.
District, what number?
Oh, I'm District 15.
I'm Dorothy Caldwell. I'm District 17. I'm also on the Public Safety Committee.
Richard Klein, Schuylkill, Palermo, on Health and Human Services.
Sarah Dunsmore, Director of Public Health. Jennifer Lampier, Principal Accountant for the Health Department.
I'm Gina Bartlett, County Legislator for District 24. I'm also on the Government and Courts.
Jessica Dever, Deputy Clerk for the Legislature.
Legislator Michael Solway, District 23, which is Granby, and into the city of Fulton, first ward, part of the second ward, and I'm also chairman of the Human Services Committee.
Veronica Turner, Budget Director.
And Phil Church, County Administrator.
Did we catch you?
Savannah Wyckoff, I'm a public information officer for the county, and I work within the tourism.
Very good. Thank you very much. Looking for a motion for approval of minutes.
So moved.
Second.
All in favor?
Aye.
Opposed? Motion carries. Resolution for under resolutions, 18-1, resolution authorizing budget modification for funds dispersed through the North Country Heart Network Delivery Partner Agreement.
I'll move it.
Second.
The County Health Department partners with North Country Healthy Heart Network to deliver Living Well Workshop Series. It's developed by the Self-Management Resource Center. This evidence-based series includes programs that focus on chronic disease self-management, including diabetes, chronic pain, cancer survivorship, and diabetes prevention. Under this agreement, the health department will offer at least 2 classes per year. The network will cover the cost of the licensing. They provide data management support, and new is a reimbursement to the department based on eligible participant enrollment and completion of the course. Classes can be offered in multiple formats, including in-person, hybrid, or a little bit of both, or just completely online also. Funds generated through this partnership, I'm requesting to use to support participant recruitment efforts and provide incentives to encourage and completion, because that's the only way we get it.
Any questions?
I have a question. Do you get large numbers of people? I think I've looked at the statistics.
And the zip codes,
Are you getting very good
we do.
response?
We do. It depends really on the time of year. Our best class that we do is a fall prevention that doesn't fall under chronic disease. But I believe we have a class of 12 right now, and it's purely online. And we have 2 that are from that dedicated zip code that, with approval, we'll be able to get paid for those if they can take the course.
Legislator Walker, do you have a question?
I'm all done. Thank you.
All in favor?
Aye.
Opposed? Motion carries.
Thank you.
AG2, resolution authorizing budget modification for preschool transportation. Looking for a motion.
So moved.
Second. Excuse me. This resolution is, the request to authorize a budget modification to exempt funds from mobility management to the health department for our preschool transportation.
Yes.
If you'll recall, when we adopted the budget last year, we were able to lower the tax levy because mobility management had received this money
Mhm.
and was able to be applied to preschool. So we deliberately underfunded the preschool line, knowing that in the beginning of this year, to be able to move this money into the line where it's needed. We were able to keep the tax levy down that way.
Moving money.
Moving money, yeah, but
And this money really is dedicated for this purpose.
And for the benefit of the new legislators, it might be good if the director could explain why the health department's involved in preschool transportation.
So
Thank
the
you.
I'd like to know too.
I was gonna ask that question.
we don't really want to be.
Mandatory by the state.
It is. So the transportation to and from any center-based preschool program is a required municipal responsibility. The costs associated usually continue to rise. This is for our preschool program, and these are for children that have a service need. A therapy, it could be they have hard of hearing, it could be blindness, it could be anything that could use a therapist, including a special needs teacher. So we send them out to these service-based centers. Here in Oswego County, we have one, which is Milestones Children's Center. They have 3 locations, one located in Pulaski, Oswego, and Fulton. The rest of our children get transported out to Jefferson County. Onondaga County is our largest number of children. The families get to pick where they want the therapy services. This is a program that the health department, we don't have a say in, but we do attend the school-based program meetings. We don't get a say in what therapies the children receive. The schools and the therapists do that.
How
This
many?
is, you'll hear more and more about preschool because this is something counties across the state scream at the state about, because schools get to pick which kids, they evaluate the kids and determine which kids get the service. The parents get to pick where they want the kids serviced. The state sets the rate and they make us pay for all of that.
And it's a
So, and we have no
tuition.
say, we have no say in the costs, and those costs continue to rise. So
That's
this is something counties continue to advocate with the state with. It doesn't make any sense that counties have to pick up the bill of all these other decisions, and we have no say in it.
And you said the state
It's a
sets the
state
rate?
mandate, yeah.
No, but the state sets the rate.
Yeah.
Yes.
Payment
Yeah.
stuff.
Yeah.
I'm curious how many children this impacts,
92 are need transportation.
and they come and they're going to basically mostly Jefferson and.
80 go to Milestone, 2 go to Jefferson County, and 11 go to Onondaga County.
Okay, so it's the major expenses when it's out of our county.
Yes.
And you said so 80 and 8 go to Onondaga. Okay, and so, but the price within the.
11 go to Onondaga.
Oh, 11.
Mhm.
The major cost is when it goes out of the county, is what you're saying too.
That's correct.
You can handle the transportation within the county easier.
Definitely.
And how often do they usually go to these places? I mean, how often do you have to make it?
Every day,
Oh, it's a daily thing. Okay. That's-
Monday through Friday.
Monday through Friday, and then they also have a summer school.
For the record, I think should be recognized by the chairman in order to ask questions, get the floor.
Okay, I'm sorry.
That's
Sure,
right.
I agree.
Yeah,
I did have my hand, but thank you.
I was talking. Sorry.
That's all right.
So it's Monday through Friday, and maybe some weekends or things like that?
No.
No weekends, so Monday through Friday. And then
Monday
my
through
next
Friday.
question, she brought up, I was asking, I would like to know who does the contract and who do we contract that service out to?
Durham.
Durham?
Durham
They've been doing it for a long time,
They have been doing it for a long time.
and I know the company, and they do a good job.
We do have some parent transportation we pay for as well. Where the parents do the transporting.
Thank you.
I have another question.
Legislator Cog.
So this is basically school. It's not just to go for a treatment or therapy or something. It's a full day school kind of thing, because you said Monday through Friday.
Yeah, it's children ages 3 to 5.
And they go, it would be like a regular school day or something.
Kind of, but they're receiving therapy services.
But they're not, it's not like a preschool program that they're getting in
That's
addition
correct.
to the.
It's called preschool, or the 3 to 5 program.
Okay, but it's not preschool.
That's what it's called.
It's just called.
Right.
I was trying to distinguish between what is preschool and what is the therapy that they're receiving, and I know that it's all integrated, but I'm just trying to.
It is PTOT, speech are the big ones.
Legislator Riddle.
And it's been going up every year, pretty dramatically. This is the first time, though, we've actually pulled money from mobility management, which is funded through mostly the federal government. I believe we owe our funding. So
This one's New York State Department of Health.
Released it.
this one is the
funding.
State Department of Health.
This funding is designated, and it's designated for transportation initiatives and distressed communities.
We're
Yeah, Legislator Soloway's next.
It says it here, maybe use to offset some of the county costs, so we'll probably be using all the 851, and there's an additional monies that we need.
Oh, yes, absolutely.
Super
It
expensive.
is
From the
super
other one.
expensive.
I was just looking that up for us.
So it's preschool for special needs.
Absolutely is.
We got legislative part.
I got it. I'm waiting on it.
No, go ahead, I'll do it.
Legislator Bartlett.
I was just gonna ask pretty much the same thing.
Aaron? What is it, what you're asking for the transfers, is that what it costs a year to transport those?
No, that's what mobility management is able to give us
Okay.
out of that
What does that cost
grant
a year to do this job?
for transportation to
Phil's working
a
on
couple
it.
million.
Okay.
It's a lot.
The top of my
But
head,
that
that sounds about right.
Preschool special education. Total budget for it is. Oh, 10.4 million. The county share in that is 4.2 million.
We pay 4.2?
We pay 4.2 out of the 10.4 million.
Question.
Legislator Cogwell.
Is that for preschool, I mean, for what we're talking about, or just our transportation? I'm just trying to,
Transportation is 2.6 million.
2.6 million of that 4.2,
Of the 10.4,
so that's statewide, or is that, the 10 million is a county,
just county, just this county.
just county, and 2.6 million of it is transportation?
Just transportation.
Okay,
For that program.
for that program.
Which is why we say this should be other, if we don't get to make the financial decisions, why are we paying for it? Normally in public administration and budgeting, the responsibility for paying for a program aligns with those who make the decisions about
Right.
it. In this case, the state has said, county's gonna pay for it, but you don't have any say in the program.
The other thing to keep in mind is that when we budget for this, it's based on mostly historical use, so we could be wrong. If there's more children in the program.
Or more services needed.
Or services needed.
Correct.
Legislator Walker.
So for you said there was 90, 92 in the program, 94 in the program?
They were receiving transportation. There's much more in the program.
Okay. So for the transportation, what does it cost in the county to do that job? Is that the 2.6 million to transport 96 kids a year?
The
Every
2.6
day, 5 days a week.
And
And during school,
And
and during summer.
Okay. It's just, to me, it's a large number.
It is, and then we pay tuition, which is around $38,000 per child.
Okay, thank you.
You're welcome.
Welcome to county government.
I've been around before.
Oh, boy. Yeah. All right, all in favor?
Aye.
Opposed? Motion carries.
Thank you.
HE3, resolution authorizing budget mod for dual settlement funds. Need a motion to discuss. By Richard Klein, second by Richard Sal. Legislator Soloway. And you'll have to, if you're not, yeah, yeah, probably I'll have to bring them up to date about, or up to speed with what Juul is.
Yep.
And what we used to do with the cigarette tax when I first came here. Yeah.
In 2023, New York State joined a multi-state settlement fund with Juul Labs Inc., totaling $462 million to address the youth vaping epidemic. They were really targeting youth, and that's where this came from. Flavored vapes on cartridges that look like they go into your computer USB drives. And you just can't do that. New York State share of that settlement was $112.7 million, which is being distributed to the counties, municipalities, and school districts are receiving this money. The settlement funds are restricted to evidence-based public health strategies only, including youth vaping prevention and cessation, community and school-based education, enforcement of vaping laws, initiatives to remediate the harm associated with e-cigarette use. Oswego County received $218,553 through this disbursement. The health department is requesting authorization to use these funds to enhance the enforcement of vaping laws and regulatory compliance. That's part of our environmental health division, where we do enforcement. To strengthen community education on vaping, cessation efforts, and planned expenditures include collaboration with our law enforcement. We'd like to use some of the money to offset costs for administrative hearings that are very costly. A smoking and vaping cessation program campaign. We'd like to use some of the money to implement a Catch My Breath youth prevention program, which we go into the schools now and do some of this work in our junior high and high school students. We'd also like to develop and distribute some education materials.
Any questions? Yes, sir.
I might just be ignorant, but what's the administrative hearings entail?
So when we do enforcement, we fine a company and they refuse to pay the fines, we bring them to hearing.
Okay.
And we hire an outside law officer to take care of that, and it does.
Well, hearing officer.
Excuse me?
A hearing officer.
Yeah,
Thank you. Thank you.
If I may, Mr. Chairman, the Board of Health appoints a hearing officer for these hearings
Okay.
as a neutral.
Hearing.
And they run similar to what it costs an arbitrator or mediator for the day. It'd be around $1,700 to $2,000 a day for each day of hearing. And then they typically charge the same for each day of writing their decision.
So what was it, 1,700?
It could run up to $2,000 a day. It varies by hearing officer, or just like it does by arbitrator. They've been going up. And then they typically charge, like arbitrators do, a day of writing for each day of hearing to write the decision, review the record. And then there's a stenographer that takes down the hearing transcript. And that's per page, plus an appearance fee.
And how successful are these?
There have been findings as a result of the hearings that they violated the law. The problem with the fines is that many times the businesses aren't around or they're not able to be collected. And then the other issue is the inventory.
Yes, that is a huge
Yeah.
issue. Also, is the inventory.
Any other questions? All in favor?
Aye.
Opposed? Motion carries. HE4, resolution appointing members to the Oswego County Traffic Safety Board. Look for a motion.
I'll second it.
All set.
I can speak to this. Is a resolution appointing Lieutenant Justin Sweeting from the City of Fulton Police Department to serve as a member of the Oswego County Traffic Safety Board.
Any questions?
Thank you. I was on that committee many years ago, and it's a good committee, and I'm sure it'll do a fine job. Thank you.
Thank you.
Could you just tell me a little bit what they do?
I can't.
Go ahead.
I can't. I don't.
You can't?
This is
Oh, you
not,
can.
this
Oh,
is
I'm
not mine. This just runs through this committee, but it's not my resolution.
I mean, I have a sense what they do, but I'm just. I'd
I
like to
know
hear
in
some-
my department, we do, child safety seats. We do the checks.
I did.
They do way more than that though.
Yeah.
But that's part of that's
Right.
what we do at the health department. I'm sorry, I wish I gave you more.
Yeah, I was,
information.
no, that's fine. Thank you, Chairman. When I was on the committee, one of the big things was they would help with the car seats, and the police would, show families how to put the car seats in and buckle them up the proper way. And it's all sorts of different things besides just that. But it's been, I think I was on it in 08, 09, so it's been a few years. But
Is that where they do the bike, for bikes?
No, the smoothie bike, that's my health education.
Yeah,
This
no,
is the
but,
bike that
I
I
mean,
have
it's
like that.
traffic safety.
one of the things that
Oh.
comes to mind is the car seats and how to put the car seats, and if somebody didn't have car seats, they would help out with all that stuff. Am I correct on that?
That's what we do at the health
Yeah,
department.
absolutely. But it's, like I said, it's been a while, but
Yes, sir.
What we can do is there's a description of the committee and what it's supposed to do that the clerk of the legislature keeps, so we can
I'm sure
stop
there is
after this
one.
with Betsy and get you a copy of that.
I was just interested, so I gotta educate myself.
it is.
No, I'm glad you asked, that no one's ever asked me, because I just don't have the answer.
Well, he sounds like a good guy, so.
Yes, yes, absolutely.
It's created under state law, the vehicle and traffic law, and the county had it under the health department at one point. It's now under a nonprofit. There are funds that are allocated to the county, I believe by the Governor's Traffic Safety Council. They have an education component as well as the promoting safety
Yes.
and awareness.
Sure, no,
But it's through integrated community planning. It used to be under the county, it's now through them, if I'm not mistaken.
Thank you.
That's good.
I don't know if you're gonna get into your report about, if this is the right time to ask about, since we were on, car seats, are you gonna do that later? Your
For
report?
the PAC minutes approval?
Yeah,
Yes.
because I have a question about the numbers. that you had.
Sure.
Should I ask now or later?
No,
I think
Yes,
after.
in your
let's
packet.
finish this.
Any other questions? All in favor?
Aye.
Opposed? Motion carries. Unfortunately, I do not have HE5 because it hasn't been appointed, so we're going to table that until next month.
Need a motion?
What is,
Yeah.
Yes, we gotta have a
I'll make the motion.
motion to table.
I'll second.
All in favor?
Aye.
Opposed? Carries. Alright. Committee review and decisions for County Health Department by numbers 2025.
Yes, so you did get a copy of By the Numbers. By the Numbers is just a snapshot of what we do until the full health report, annual report comes out in March. But just to look at our numbers and what we've done for 2025.
question?
Let's go.
I was looking at the car seat numbers.
Mhm.
And it says 36 new car seats reaching 44 families. And I just was curious about, it's 44 families, but only 36 seats.
We might have done car seats that they already owned and they didn't need a new one. They just needed to know how to
Okay,
put the old one in.
okay, thank you.
You're welcome.
Professional advisory committee?
Yep, so our PAC minutes, this I do need approval for if everybody had a chance. This, we're usually a quarter behind always. So this is September's minutes.
Yeah, I'll move those minutes.
Okay.
Thank you.
Jessica, did you get that? So you're a quarter behind.
We are quarter behind, and
Always.
anybody, yes,
Okay.
anybody
Any
have
other
any questions regarding our full advisory committee?
All right, Director's report.
Well, let's call for a vote.
Oh, I'm sorry. All in favor?
Aye.
Opposed? Motion carries.
Keep me honest.
I'll explain myself after we get done with all this. Reporting departments.
I'll be quick.
What's that?
I'll be quick. So our accreditation, our plaque did come in from the accreditation board. It is beautiful. I did request to be recognized at the full legislative meeting on the 12th. So hopefully we'll have that. Strategic planning, we're just waiting for the last couple of names of who's going to be serving on the Board of Health. And now that we know who's on the Health Committee, that part's done. So we're just waiting for the last couple names for our strategic plan, and that will be shared with you next month also. We're looking at our big focuses for the next 4 years. So this strategic plan goes from 2026 to 2029. We're looking at workforce recruitment and retention and development, expanding programs and community partnerships, and planning and preparing for emerging risks. These were chosen for us by our community, by our legislators, and by our staff.
Thank you, Vera.
You're welcome.
Question, thank you, Mr. Chairman. Question, you said there's 4 openings on the board or committee?
On our committee?
I thought I just heard you say you're waiting for 4 appointments.
No, I'm waiting for the appointment of who's gonna go on the Board of Health.
That's what I meant.
Oh, so,
It's a committee.
yes, there'll be
Yeah.
2.
There's
There's 2 openings,
There's 2 openings now,
yes.
and did they retire, resign?
One, retired,
And how many are on the board?
7.
There's,
That's a good guess.
okay,
7 is a good guess.
okay. You think you can
Yeah, I can probably.
give me that answer?
Yes, absolutely.
Okay, so you think there's 7 on the board, correct?
7, yes, yes, but we have 2 vacancies.
So you have 5 current and two vacancies.
That's correct.
And how do their terms run?
2-year term, and I have to give you the information. I don't have it off the top of my head, but I can even send you a copy of the bylaws if you would like to look at them.
Yeah, if you could send them.
Absolutely, I can do that.
So you believe there's 7 on the board, there's 2 vacancies, so there's 5. And when you have, how often do they meet?
Once a month, and it's the first Friday of every month at 9:30 a.m.
And you give me all that information?
I could, yes, I
And
absolutely.
where do they meet? Here?
At the health department, up in the administrative conference room on the 2nd floor.
And how, do you always have enough for the meeting when you have the meeting?
Yes, for a quorum, yes.
And in that list, could you give me who's currently on it?
Yes, absolutely.
The clerk of the legislature has a list of all the advisory boards
Yeah.
and with all that detail.
Sure. Well, it's nice to be able to ask the director
Sure.
what's going on.
But if you want more than that, that's what I'm saying.
Yeah.
Mm-hmm.
You get a list.
And all of our Board of Health minutes are always on our website.
Okay?
Yeah.
Thank you.
You're
Picture this
welcome.
on, sorry.
So I can answer your questions, but I will give you
No,
the
that's okay.
information.
Yeah.
Okay. Guess that's it.
I would like to invite anyone that would like to come over to the health department to learn more about what we do. Please call me, set up a time. I definitely have, and I have to do, we're not done yet. I have to do
Are we at the
rabies.
end of the meeting?
Almost.
I have to do rabies real quick. I'm so sorry.
You got,
Rabies
oh,
clinic.
okay.
Yep.
If I ask questions, could you, if we're going along with these, or would you like me to wait for you to pass these out?
No, you can't.
Okay.
You go back to yours.
Okay, thank you. So this is the rabies clinic schedule. This is important that I get okay from you that I am able to move forward so we can bring it forth to the full legislative next month. So
So we have to have, so basically it's like a
I
resolution,
just like you to, it's not a resolution, it will be next month. I
okay,
need you to just look at it, make sure everybody agrees with it.
okay,
So,
and we'll do this next month.
and I'll bring it to
Okay,
this board next month.
We can go back. I do have more questions that I want to ask.
Yeah, go ahead.
It's not to pertain to this.
go ahead.
I have a lot of questions that I told you I was, when I talked to you earlier, but I wanted to talk to you about health and inspections of restaurants.
Yes,
You're in charge of that, am I correct?
you're correct.
Okay. Who does, and how many people do we have that do the inspections on restaurants throughout the county's huge. And in my district, I have a lot of restaurants. So how long do we have do they inspect? And I've had some calls recently that people would call and make a complaint and you just wouldn't take the complaint because the folks were afraid to give their name. So you just wouldn't do it and take the complaint.
Well, it does remain anonymous, but I would need the name of the person making the complaint. Because
Okay.
they'll get the information back. So that's important, but it does remain be anonymous.
Okay.
And I do have 5 people doing restaurant inspections, and that number can increase, give and take, during the year. So we can go, right now, there's pretty much 5 people, but they have other jobs also.
Okay. And the next question on that is, I was told that when you're, like in the fast food industry, they have the fryers and they have the Ansel systems. And I was told that they're supposed to be cleaned every 6 months. I don't know how true that is, or, and do you folks inspect the Ansel systems and the
We do,
fans
but it's annually. We do
It's
annual
and
inspection.
annual
Mhm.
inspections? Okay. And then go by on complaint basis, or do you, do you
Yes, if
pop
we
in
get
and
a
do
complaint-
pop-ins?
Yes, especially if we get a complaint, we'll do a pop-in.
Okay. But if not, if there's no complaint on a restaurant, whether it's fast food or
We would do
Fine.
pop-ins,
fine dining, you do pop-ins and
yes,
do general once a year, no matter what inspections?
yes, and then some are more often.
If you got complaints and things of that
So
nature,
we got complaints or if they're high risk.
high risk, okay. And I thank you very much.
You're welcome.
So
Paula,
that's what it does.
are these inspections that are annual, do they know ahead of time or do you just come in? I mean, I have
Usually-
a regular schedule.
Sometimes if we want somebody there, we'll call ahead and say, can you meet us at this time? Usually we're going.
Good.
Pop-in. Sometimes if they're just opening, if they're seasonal, sometimes they'll know that we're coming. Because they have to, because they need to be open when we get there.
Right.
I would invite anybody who has any other questions or concerns to visit her in
Yeah.
her office.
Oh, we will.
I just took this
Thank you.
committee over a year ago. I
Okay.
was on other committees.
Yeah.
And by the second month, by February or March, I was like, okay, what am I doing here? And she took an hour of time that turned into 2.5 hours. When she got done, she said, we almost had as much power as a DEC. And we know how the DEC can be, so.
There you go. Thank you. Yep, appreciate it.
Just for the new people.
Yep.
All right, if there's not anything else, Legislator Rayhill.
Do we need a motion for the rabies clinic schedule?
That's what she
Oh,
said.
We
next
don't,
one.
I just need, they go ahead and bring it to next month. If it looks all
So it
right.
was brought to our committee so that we knew which ones, basically
Got
last year's the 2025.
I always flip the Hastings and West Monroe,
Yeah,
and then our Hannibal and
Andy.
Brandon.
yes, sir. Legislator.
On this list that you have here, I see that there isn't any in the city of Oswego.
We had a City of Oswego last year and we didn't do very well.
Really?
Yep, your numbers are on the other handout that I handed out.
It was the lowest number.
It was the lowest
Yep.
number. So we decided to stick with our, what we know this year and stick with community-owned facilities,
Where
or
was,
county-owned facilities
okay, where was it last year in the city of Oswego?
at the DPW at the highway,
Okay. So Scribe is just outside the boundary.
right?
So it's, you know, and we only had, how many calls did we have in the city this week last year? Is that 19 now I'm looking at? No, that's negative. Rabies program.
The
129
the
calls in
clinic
the
data.
city.
Yeah, no, but I went for the program for the shots.
That's on the back page, I believe. City of Oswego, vaccines given 136. We'd like to hit the 200 number. Usually our first one is usually in a little higher than 160. But we'd like to hit the number 200 is our goal when we hold the clinic.
And you don't think we need to go that route in the city of Oswego?
No.
Legislator Klein.
Yeah, keep in mind one thing on this, and for the new legislators, you wouldn't know this obviously. But mandated by the state, we only need to have 4. So we're going above and beyond and taking from the taxpayers' money to have 8 of them. So just so you're aware of that. Mandate is 4.
So the most bang for our buck is what I'm
There you
trying
go.
to accomplish.
Anything else?
Yes.
Let's-
How we doing on our mobile home up there? First of all, has anybody shoveled off the old one?
No.
Okay, that
But I
could be
should
problem.
have do a flyover like I did last year, and Kevin Foley will do that for me. When he's out that way, he can do a quick flyover to see how the trailer's holding up.
It's not gonna do worth a damn if it goes flat.
So if there's anybody
Yeah, but
Anybody
well,
has any
we're getting
questions,
a new one.
what they're talking about is we have it's a double wide in the swamp in West Monroe. That's where the health department does their mosquito counts. They have different pools all over, so.
We are getting a new trailer this year.
Yeah,
Yeah,
well,
how we doing on
hopefully.
it? That's what I wonder.
We're working with purchasing.
I mean,
to
that's
get
what I
that.
do for a living. Something like that could collapse at any time, how much snow's on it. So I don't know if that, to me, that would be a priority to have somebody go up there. Is there access to it?
No,
No.
not
This
without,
time,
no.
no,
but-
I don't
it's in the
think-
middle of a swamp.
No, it's out there.
It's 30 years old. We didn't think it was gonna survive last winter. We do have money to put in a new trailer, and that's where we're going
If it collapses, it just helps us with the demo.
with the demolition.
No,
seriously. What about what's
No,
inside?
seriously.
Dude, we clear it out, all the expensive stuff, yes.
Well, and if it made it through last winter, right now on the North Shore, we're in better shape than we
Exactly.
were last
You're
year.
not gonna, yes, so.
Yeah, one more, quick question on that. Where are we at for the water source? Because there was discussion about bringing water maybe from the West Monroe water system, or
No,
what are we gonna do? Because,
we're gonna drill a well.
and we're gonna be able to keep the contamination out of this one.
That's what we're hoping.
Hoping doesn't do it.
If we have to treat it, we have to treat it. Right now, we're bringing in bottled water for the staff. They
Well,
can still
we're
flush the
proposing a
toilet.
drilled well.
We are, because it's a dug well right now.
Oh, I know, I've been out there.
Okay.
Chris Williams took me out there and I was at that facility, and you drive up, you get that well, and they uncover it, you're gonna run from it. It shouldn't be used, it's gotta be filled
So
in.
you've been down there to see the site.
I certainly
I
have
never was
that.
down to see the site. I've been here since 18 and never down to see the site until I took over this committee. And I was blown away when I actually went right to it.
It's interesting when you go out there and you see the work that they do, how they count the mosquitoes. They physically count the different petri dishes. They dump them out, and with tweezers under a lighted magnifying glass, they count the mosquitoes. And
To
I
separate
can
by
identify the
species.
ones with the shoes on.
Yes.
They're like they got boots on,
Yes.
little booties on.
Yeah.
Then they put them in test files and they send them in to be tested.
It's only certain mosquitoes will carry the AAA virus.
Yeah.
And what town was this in?
It's in West.
West
It's in
Monroe.
West Monroe.
You can cross-country ski there now.
You can.
Can you?
No,
I think that'd be kind of rough.
All right. Anything else? Looking for the appropriate motion.
Motion adjourned.
Second.
All in favor?
Aye.
Opposed? Carried. Thank you very much.